In the second section of our topic, lung abscess, now let's move on to pathology and microbiology of primary lung abscess, secondary lung abscess, and then also we will discuss about the clinical presentation of the primary and secondary lung abscess. So primary lung abscess, most common location of the primary lung abscess is the posterior upper lobes of the lungs and superior lower lobes. So posterior upper lobe and superior lower lobes are most commonly affected sites in the primary lung abscess. Predisposition of aspirated material. So the predisposition mostly is as a result of aspiration of different material that can lead to the lung abscess, and the sites are posterior upper lobes and superior lower lobes. Right lung is most commonly affected, so right side of the lungs is affected, or right lung is affected as compared to the left lung. Secondary abscesses, location of abscess vary with underlying cause. We know now, we talked about the pathogenesis of primary and secondary lungs in the first section, and we know that secondary lungs is due to some underlying conditions like obstructions, and whatever is the cause of the secondary abscess, the location of the abscess depends on that side. But in primary lung abscess, we said that it's mainly the posterior upper lobes, posterior part of the upper lobe and superior part of the lower lobes of the lungs are mainly affected. Right lung is more commonly affected as compared to the left lung. Next, some microorganism that can cause the primary lung abscess. We have the anaerobic organisms. We already know anaerobic mainly cause the primary lung abscess. And then also microaerophilic streptococci. Examination is done via the culture, blood culture of the microorganism is performed. Culture is very important to find out the exact causative organism. So we should start the right antibiotic from the beginning. So examination is via culture prior to antibiotic administration, and it's always important, even if we want to start the antibiotic, it's better to get the culture before starting antibiotic so we can get the right information. Avoided techniques are the transtracheal aspiration, bronchoalveolar lavage with protected brush specimen. So avoided techniques should be the transtracheal aspiration, broncho. These are the avoided techniques. Non-specific lung abscess. So primary lung abscess can be non-specific lung abscess if no pathogen is present in the abscess 40% of the time. So it's non-specific. No microbial organism is found on the culture, and this is known as non-specific lung abscess. Then we have putrid lung abscess, which is foul-smelling breath, sputum, ill-smelling empyema, diagnostic of anaerobic lung abscess. So in conditions of where the lung abscess is caused by anaerobes, the there is foul smelling sputum and foul smelling breath is present, as compared to non-specific, in which we have no microorganism. But this foul smelling putrid type of putrid lung abscess is mainly associated with anaerobic microorganism. So very important, primary can be non-specific and putrid type, which is due to anaerobes. Next is secondary lung abscess. Broad bacterial spectrum is associated with secondary lung abscess. Common infections are the Pseudomonas aeruginosa and gram-negative rods. So we said primary was anaerobic and microaerophilic streptococci, and here this secondary is mainly due to Pseudomonas aeruginosa and gram-negative rods. Fungal infections can also lead to secondary lung abscess, and it's common in immunocompromised, immunosuppressed individual who are immunosuppressed, and the fungal infections can occur leading to lung abscess. Culturing done to target therapy. So blood culture is done to target the therapy for the secondary lung abscess. Pathogens causing lung abscess. So these are all the pathogens can cause the lung abscess. These are the clinical conditions, and then we have different pathogens causing those conditions. We already talked briefly about the primary and secondary lung abscess. So primary lung abscess is by anaerobes, which is Streptococcus, Prevotella, bacterioids, Streptococcus, microaerophilic. So mainly anaerobic and microaerophilic streptococci. Secondary is often due to Staphylococcus aureus, gram-negative rods, Nocardia, Aspergillus, Mucorales, Cryptococcus, Legionella, Rhodococcus, and Pneumocystis. So all these are different causative organisms for the secondary lung abscess. Next, another condition is embolic lesions. In this, usually we have Staphylococcus aureus and Fusobacterium necrophorum. Then endemic infection, Mycobacterium tuberculosis, coccidioides, histoplasma, blastomyces, parasites like Entamoeba histolytica. So all these are different endemic infections. Some miscellaneous conditions like bacterial pathogens, often like Staphylococcus aureus, after influenza or other viral infections. These are different microorganisms associated with different conditions. Primary lung abscess has different pathogens, secondary has different. If it is due to emboli, the causes are different. So depending on the condition, clinical condition, we try to rule out the causative agent. And again, so many different microorganisms are involved that we need to do the culture to find out the specific treatment against that infection. Clinical manifestations are similar to those of pneumonia, and these are its abscess, its infection. So fever is usually present, associated with cough, sputum production, which is foul smelling, foul tasting, especially we mention in anaerobic infections, it's foul smelling. Chest pain because of the involvement of the lungs is present. Night sweats, fatigue, anemia is also present. So all these are different conditions or manifestations associated with the lung abscess, which can be primary or secondary. There is also discolored phlegm. Phlegm is the sputum. Phlegm is the secretions from deep from the lungs. When it comes, it's discolored. It's usually the blood tinged or another. So it's discolored type of phlegm is present due to Staphylococcus aureus. Usually we have high fever and rapid progression. Poor dentition and gingival disease. We mentioned already that it's very common factor in primary lung abscess, aspiration and poor dental hygiene, poor oral hygiene, gingival infection, all these can lead to the aspiration and development of lung abscess. Then amphoric or cavernous breath sounds on lung auscultation are present. Digital clubbing. Clubbing, you can see the raised fingernails and there is absence of gag reflex is also present. That's the person with the clubbed fingers. Clubbing of the nails. So that was all about the section 2. Thank you for watching sqadia.com.